How to treat and cure myxoma. Myxoma is a rare benign soft tissue tumor composed of fibroblasts embedded in abundant myxoid stroma. Myxomas have a gelatinous consistency, resembling the fetal umbilical cord. They may be derived from modified fibroblast cells. Sometimes, malignant tumors can undergo myxoid degeneration, making difficult to distinguish from myxomas on an MRI. In other words, malignant myxoid tumors can have a similar appearance as a myxoma on an MRI, which is also similar to a ganglion cyst. Atrial myxoma is a form of a benign tumor which is usually located in the left upper side or the right side of heart. This tumor is usually found on the wall which divides the heart into two parts. The name given to this wall is atrial septum. Myxoma is a non-cancerous primary heart tumor, usually irregular in shape and jelly-like in consistency. People may feel short of breath or faint, or they may have fever or weight loss. Doctors confirm the diagnosis with echocardiography. Surgery is needed to remove a myxoma. Half of all primary heart tumors are myxomas. 3/4 of myxomas occur in the left atrium, the chamber of the heart that receives oxygen-rich blood from the lungs. Myxomas usually develop in women, typically between the ages of 40 and 60. Some uncommon types of myxomas run in families. These hereditary myxomas, part of Carney complex, a syndrome of various non-cancerous tumors, usually develop in young men in their mid-20s, and they can occur in one or more of any of the chambers of the heart. How a myxoma can block blood flow in the heart. A myxoma in the left atrium often grows from a stalk and swings freely with the flow of blood. As it swings, the myxoma may move in and out of the nearby mitral valve, which opens from the left atrium into the left ventricle. This swinging motion may plug and unplug the valve over and over again, so that blood flow stops and starts intermittently. Myxomas in the left atrium often grow from a stalk and swing freely with the flow of blood, as a tether ball does. As they swing, they may move in and out of the nearby mitral valve, the valve that opens from the left atrium into the left ventricle. This swinging motion may plug and unplug the valve over and over again, so that blood flow stops and starts intermittently. Symptoms of myxoma. When they stand, people with a myxoma in the left atrium may feel short of breath or may faint. When a person is standing, the force of gravity pulls the myxoma into the opening of the mitral valve, blocking blood flow through the heart. This blockage causes transient heart failure. Lying down typically causes the myxoma to move away from the valve and relieves the symptoms. Pieces of a myxoma or blood clots that form on the surface of the myxoma may break off, becoming emboli, travel through the bloodstream to other organs, and block arteries there. The resulting symptoms depend on which artery is blocked. For example, a blocked artery in the brain may cause a stroke, and a blocked artery in a lung may cause pain and coughing up of blood. Emboli are the most common complications of myxomas. Other symptoms of myxomas include fever, weight loss, joint pain, Raynaud syndrome, the fingers and toes become cold and painful when exposed to cold, a low red blood cell count, anemia, a high white blood cell count, and a low platelet count. Anemia may cause fatigue, weakness, and paleness. A low platelet count can cause problems with blood clotting. What are the causes of myxoma? Myxoma, as stated, is a tumor present near the heart, hence, it can be stated as a cardiac myxoma or cardiac tumor. This tumor is pretty rare in occurrence. Majority of myxomas that occur are present on the left side of the heart. These tumors are usually located on the atrial septum. This disease is commonly found in females, and most of this disease is inherited. Such tumors which pass down from families tend to cause symptoms in an individual at a very young age. What are the symptoms of myxoma? Some of the symptoms of myxoma are shortness of breath when lying, shortness of breath with sleeping, chest pain, dizziness, syncope events, palpitations, cyanosis in the fingers, cough, fever, malaise, joint pains, generalized swelling, weight loss. How is myxoma diagnosed? If myxoma is suspected, then the treating physician will conduct a detailed physical examination and check the heart for any abnormal sounds or murmurs. Apart from this, imaging studies may be conducted to include chest X-rays, CT scan of chest, EKG, Dopplers, angiography, CBC, ESR. What are treatments for myxoma? The normal method of treatment for myxoma is to remove the tumor surgically. Mitral valve replacement may be needed in some people. This disease tends to recur if all of the tumor is not removed at one time. Myxoma is not cancerous, but if not treated adequately can cause embolism or make the tumor malignant. In case the tumor spreads to the inside part of the heart, then emergent surgery may be required to avoid lethal complications. Diagnosis of myxoma. Imaging. Myxomas are suspected based on the person's symptoms. With a stethoscope, doctors may hear a sound, heart murmur, produced by abnormal blood flow. The myxoma may block blood flow to or from the heart. Because many symptoms of a myxoma may also be caused by many other disorders, extensive testing may be needed before a diagnosis is made. Blood tests may show inflammation, anemia, and a low number of platelets in the blood. But none of these tests is conclusive. The diagnosis is confirmed by echocardiography. Other procedures, including angiography, computed tomography, CT, and magnetic resonance imaging, MRI, are sometimes necessary. Complications of myxoma. Some of the complications associated with myxoma are arrhythmia, pulmonary edema, metastasis, mitral valve blockage. Treatment of myxoma. Surgery. Surgical removal of the myxoma usually cures the person. After surgery, echocardiography is done periodically for about 5 years to be sure that the myxoma does not recur. There is no known causative agent for myxoma. The main symptoms, if any, produced by myxoma are generic and not specific. These include fever, weight loss, anemia, elevated white blood cell, WBC, count, decreased platelet count, and Raynaud's phenomenon. Most patients with myxoma are between 30–60 years of age. Diagnosis. Diagnosis is made following a suspicion that a myxoma might be present, and can usually be confirmed by echocardiogram. Treatment. Surgery is used to remove the tumor. Myxomas can regrow if they are not completely removed. The survival rate for this operation is excellent. Prognosis. Successful removal of the tumor rids the patient of this disease. Emboli from a myxoma may survive in other areas of the body. However, there is no evidence that myxoma is truly metastatic, able to transfer disease from one area to another, causing tumors in other areas of the body. Myxoma is a rare benign soft tissue tumor composed of fibroblasts embedded in abundant myxoid stroma. Myxomas have a gelatinous consistency, resembling the fetal umbilical cord. They may be derived from modified fibroblast cells. Sometimes, malignant tumors can undergo myxoid degeneration, making difficult to distinguish from myxomas on an MRI. In other words, malignant myxoid tumors can have a similar appearance as a myxoma on an MRI, which is also similar to a ganglion cyst. Myxoma is an intracardiac tumor. It is found inside the heart. 75% of all myxomas are found in the left atrium, and almost all other myxomas are found in the right atrium. It is very rare for a myxoma to be found in either of the ventricles. The tumor takes one of two general shapes, a round, firm mass, or an irregular shaped, soft, gelatinous mass. They are attached to the endocardium, the inside lining of the heart. The cells that make up the tumor are spindle-shaped cells and are embedded in a matrix rich in mucopolysaccharides, a group of carbohydrates. Myxomas may contain calcium, which shows up on X-rays. The tumor gets its blood supply from capillaries that bring blood from the heart to the tumor. Thrombi, blood clots, may be attached to the outside of the myxoma. There are three major syndromes linked to myxomas: embolic events, obstruction of blood flow, and constitutional syndromes. Embolic events happen when fragments of the tumor, or the thrombi attached to the outside of the tumor, are released and enter the bloodstream. Gelatinous myxomas are more likely to embolize than the more firm form of this tumor. Myxomas may also obstruct blood flow in the heart, usually at a heart valve. The mitral valve is the heart valve most commonly affected. Blood flow restrictions can lead to pulmonary congestion and heart valve disease. Embolization can lead to severe consequences. In cases of left atrial myxoma, 40 to 50% of patients experience embolization. Emboli usually end up in the brain, kidneys, and extremities. The third syndrome linked to myxomas are called constitutional syndromes, nonspecific symptoms caused by the myxoma.